Thank you very much, Joy. That's much appreciated. And thanks everyone for joining us. For those of you who do not know me, my name is Petra Vergeer. I'm the GFF lead for Knowledge and Learning and RBF. I'm very pleased to have you all join us for this exciting webinar on private sector engagement during COVID-19. I know we have representatives from many of our 36 GFF supported countries, including colleagues from Afghanistan, Bangladesh, Burkina Faso, Cambodia, Cameroon, Central African Republic, Chad, Cote d'Ivoire, Democratic Republic of Congo, Ethiopia, Ghana, possibly Guatemala, although it would be very early there, Guinea, Haiti, Indonesia, Kenya, Liberia, Madagascar, Malawi, Mali, Mauritania, Mozambique, and colleagues from Myanmar who will be presenting together with colleagues from Ethiopia, Niger, Nigeria, Pakistan, Rwanda. I saw already colleagues connected from Senegal, Sierra Leone, Somalia, Tajikistan, Tanzania, Uganda, Vietnam, Zambia, and Zimbabwe. So that is quite a large number of countries. And I know this topic of private sector engagement during the context of COVID-19 is being something very, very on many countries' minds, and also shows new struggles, but also new opportunities. I'm very happy that we have a large group of representatives from different organizations and countries to speak to this topic. We will start with Sneha Kanagati, who is the private sector lead in the GFF. After that, we will hear from David Clark, who is the team lead of universal health coverage and health systems law at WHO. He will talk about a call to action to mobilize the private sector for COVID-19 response. We will then hear from Dr. Shua Lin from the Ministry of Health and Sports in Myanmar, followed by Dr. Tetet Kain, who's the General Secretary for the Myanmar Private Hospital Association and Managing Director for the Run Lang Silaom hospitals. I'm truly sorry if I'm not pronouncing the hospital names correctly, but it will be very much about how the public-private dialogue has been evolving in Myanmar to respond to COVID-19. We will then hear from Dr. Marcos Feleke, who is the president of the Ethiopian Healthcare Federation, and he will talk about the private dialogue to respond to COVID-19 in Ethiopia, but also a little bit about what happened before COVID-19 happened. There will then be a panel discussion with all these colleagues, and we will also be joined by Caroline Kuyada, who is a principal associate for international development with APT Associates, and also works on USAID's SHOPS Plus program. She's also a GFF Investors Group representative. Following the panel discussion, there'll be time for questions. As Joy already alluded to, and you can do this throughout the session, if you have any questions or comments or experiences you want to share, please email them to myself or to Joy if the questions are in French, so that we can, following the panel discussions, also answer your questions. With that, I'm very happy to hand it over to Sneha to take us to set it off.
Thank you, Petra. Good morning, good afternoon, and good evening, everyone. I'd like to set the stage for the presentations and the discussion that you'll be hearing today. Next slide, please. So, as we're aware, COVID-19 has brought many challenges that are straining our health systems in many new and unexplored ways. And we'd like to discuss today whether working with private sector providers can be part of the solution for the problems that we're seeing. In terms of our countries, the GFF-supported countries are taking many different paths. Some of them are building on existing platforms where there's public-private dialogue happening, as well as engagement, and looking at how COVID discussions can be brought into that. Some others who have been discussing a broader dialogue on health systems with private sector are now doing joint response plans for COVID-19. And still other countries are looking at short-term contracts with private sector for a specific gap or for surge capacity in a particular area. And you'll hear more about these approaches from our speakers today. This has also led to some opportunities and challenges, opportunities such as giving ministries of health the ability to leverage private sector capacity for COVID response, as well as for essential services. Challenges that private providers are facing to continue their operations despite the constraints and reduced demand from patients during the pandemic, and an opportunity perhaps for longer-term partnerships for the Ministry of Health with the private sector, even beyond this time where we're grappling with COVID. I'd also like to just take a moment to describe the support that GFF has available for countries from the Secretariat and partners. One is through our ongoing support to programs at country level, both in terms of public-private dialogue, engagement, strategies, as well as the contracting efforts that are funded by the World Bank and GFF that leverage private capacity as well as the public sector providers. And the other is around collaboration with partners such as WHO, where together we're ready to provide technical assistance and resources for the Ministry of Health and private sector to work together strategically. So with that, I'll turn it over to our speakers, starting with Dr. David Clark from WHO. Next slide.
Sorry, Sneha, just a second, because David is not online yet.
Sure. So let me ask then maybe if Dr. Choswale is online from Myanmar. Otherwise, I think we could start with Dr. Tet Kain, who I see is connected.
Oh, sorry.
I hear from colleagues that Dr. Choswale is connected now. Can you hear us?
Please request to speak on the bottom right-hand side of your screen.
Yeah, I can hear.
Is that you, Dr. Choswale? Great to see you. Thank you for joining us.
Yeah.
If you're ready, we'd like to start with your presentation now.
Yeah.
Great, thank you. Joy, the second presentation, please.
Hello. Good morning, good afternoon, and good evening, everyone. I'm Dr. Choswale from Myanmar. I'm the director of the private sector of the Ministry of Health. I would like to present the perspective of the private-public dialogue and a response to the COVID-19. Everybody knows that disease has no boundary, so that we have so many things to do to overcome the social kind of the barrier. So we have the private sector law. According to the private sector law, private healthcare law, and the authorized body is the Central Committee. In terms of the Central Committee, we have to manage the private healthcare concerns to the development also. For my aspect of my sector, my organization is the facilitating organization between the investor of the private sector, and then the government sector. For the example that according to the private healthcare law, authorized body is central committee. So we have many the step and the procedure up to now. So we get in terms of the quarterly meeting and the other activities, including the GFF activities, we conjoined to develop up to now. So that, and the next time, please, we have the GFF collaboration activity, including the private-public partnership symposiums with the hubs, with the organizations of the NIMR Academy Medical Science. This MEMS is the one sector, one organizations of the one members of the central committee of our government law. So MEMS is the one organization to try to collaborate with the private development. So for the MEM, for the sides of the GFF activities, or MEMS try together collaboration with the GFF and our law, under the law, so that we have the many quarterly meeting since 2016. And after that, the GFF activities and the MEMS partnership symposiums, MEMS make the facilitating our health sector assessment, collecting the data, including the collecting the data, interviewing with the stakeholders. During our dialogue, then the COVID hits our country. So that we make the private public stakeholder transit to joint action and plan to be make the 3-week sprint to respond to the pandemic. Next slide, please. The next slide. So we have after the pandemic. After the pandemic, we make the close contact with the private and public sectors. Including me, I make from the public sides or the private sides or the government sides or the other well-wishers. We have facilitated the period to overcome the COVID-1. So after we have the many discussions or many challenges, we make that, and we have with the help of the consultants Barbara and the GFF groups, so we make the 3-week sprint to create for the private-public dialogue for overcome and the huge or such situation. So we have the 3-week plan. Now we make the third week of this such a dialogue to make the action plan and the support to our Ministry of Health, our groups. So I am the one of the facilitator of the 3-week sprint created opportunity dialogue. And there is plenty of the topics, not the plenty, there's 8 or 7 topics about the concern with the action plan. So we make from the thematic areas of the 3 areas, we choose according to the planning section, so 1, and after that we have another second with the planning section 2 and the planning section 3 for the action for the proper way. So we have the intensive dialogue, and we make the several meeting for the discussion and serious discussions prior to the health issue. So that we mentioned these conditions with the sector like that, the organizational sector. We have the organization of Ministry of Health body, and the MEMS is the one of the think tank of the MEMS to support to provide the suggestions, any suggestions, and under the guidance of the MOHs and the regular dialogue. So the MEMS and the other organization like that, the well-wisher groups, donor, and other Food and Drugs Association, other ministry, the planning for to face to overcome our COVID period, so that from the serious discussions of the primary health issue, we make the rapid strategy planning process to develop the private-public collaboration response to COVID-19 action plans with the guidance of the GFF of 3-week sprints process. And after that, we prepare for the submitted to MOHs the steering body, main body for concerning with the emergency response measures. For example, that one thing is the organization network, and the second thing is the more detail for the healthcare management. Another points for the testing, laboratory testing, and the other points for the logistics supply management system. So now we have to do the third week period for the development draft for the action plan. So the next slides, please. The next slide, please. So we have the collaboration area to do the pillar and the Myanmar national plan, and the case management, and the laboratory testings, and the logistics and the supply. Case management is in mind the experience about the quarantine cases and the PUN cases, and also the positive cases. So in my country, we have managing about the quarantine area or the facility quarantine is we do with collaboration with the many sector, multi-sector collaborations for the case detection. After the case management from the quarantine side, if there is a person with the PUI, we make another PUI and the care on the hospital area or the hospital quarantine. And also if there is the definite diagnosis for the COVID ones, so we manage as the COVID positive patient and hospital care. So that we have the plan to provide the guideline to prepare the private sector to treat or anything or to like such hits condition. Not in such conditions, we create the mechanism for the greater coordinations after the course of COVID. And also in the case management, we have also the important matter is that the laboratory testing. Integrated, coordinate the private public sector of the testing capacity. Now we have the area to expand the area of the private testing, including the national health laboratory and the research area and the other state and regions. For example, that the Molamyang region or the Shan state. So that including the military, military medical service also for the testing. And in that we have the testing capacity to promote the private facility, random facility. We made another technology, something like that, the immunoassay, or now that we are using only for the PCR for the confirmed test. So that in that period, we have this many kinds of the PPE, for example, that, and also the many kinds of the mask, so that logistic and supply area is a very important one to do the good quality or the safety measure, and so that we make the collaboration area of the logistics supply to supply and demand is a very important both the private and public one, because of we need the organization like the groups, third-party groups like the consortium groups, so that we make for the supply, logistic and supply system and the weak area to be proper procure central selected number of the COVID essential supply or the item, the emergency response, the response items, such a kind of the preparedness and our national plan balance. So that now we have the 3-week sprints for this area. Okay, and please the next slide. So that we have the such the collaboration area we submit to the MOHS and the proper one. So that the main take out note is that one organization is very important in this period, and the network, including the local or the social kind of the GFF or facilitator of the World Bank or the outer area, and we have another implementator, such example for my private sector organization, so that we have now prepared for the another close collaborations and cooperation between private sector and private sector through the dialogue and through the after private sector assessments, after the result of the based on the private sector assessment figure. And another thing is the very thank you for the GFF of the groups facilitate and the import the very important factors and effects to our groups. So thank you for this. Thank you for the preparations and the joining for me. Good luck. Okay.
Thank you very much, Dr. Choswale. That was very interesting. I can clearly hear how in Myanmar you had initiated discussions, and you have now, during COVID, really started in a 3-week sprint to really have private sector collaboration on case management, laboratory testing, and taking care of logistics and supplies for all COVID-related items. So it's very interesting to hear. I'm also very pleased that David Clark is now online from WHO. As I mentioned earlier, he is the team lead for Universal Health Coverage and Health Systems Law, and he will talk to us about a call to action to really mobilize the private sector for the COVID-19 response. David, over to you, please.
Thank you very much. Will somebody put up my slides, please? Thank you. So thanks, everybody. I'm sorry we had some technical difficulties. I did hear the last presentation, and it was really interesting to hear about the experiences of the colleagues. So for a while, WHO has been working on the topic of private engagement in the context of our broader work on supporting countries' efforts towards universal health coverage. And when the COVID situation hit, we very quickly switched gears and looked to how we could support countries to work on COVID. We recognized very early on that for countries to deal with the COVID situation, that we needed to take a whole of health systems approach to COVID. And so we started off with a call for action about the importance of mobilizing all health system actors, not just the public ones, including the private sector for the COVID response. Next slide, please. Next slide, please. Thank you. Why this is really important is that most LMICs, as many people will know, have very large private sectors. So unless we work with the private sector as part of the COVID response, we're only really working with part of the health system. And what we saw very early on in the response is how important it was to work with the private sector. We saw a proliferation of private sector engagement across a number of different countries. In the first instance, when the epidemic was hitting the European countries in particular, we saw a lot of activity in the European countries bringing extra hospital beds, extra ventilators, extra staff, and other resources into their national response through private sector engagement mechanisms. And what's interesting about this is all of these countries had existing mechanisms for private sector engagement. They had existing public-private partnership platforms, and they had existing tools such as contract mechanisms that allowed them to bring the private sector into their response. Next slide, please. Next slide, thank you. So, but as the COVID situation has unfolded, we've been doing a lot of work to support our member states with their COVID response. And as part of this response, we wanted to be really clear about what sort of issues that they were struggling with in relation to COVID. And what we found is that the COVID response has highlighted some existing weaknesses in relation to private sector engagement that have been there for a long time. But what's made them now critical weaknesses is the fact that unless we effectively engage with the private sector response, we're going to be really hampered in relation to the health system, particularly as we get to the point where, I'm sorry, could the person who's speaking please mute? I'm sorry, I can't hear. I'm sorry, my slides have gone. Thank you. And we did a survey very early on to talk about, to look at what key policy challenges that the countries were facing. And we found a number of things. We found that some countries are still really unwilling to work with the private sector. Unwilling, or in some cases that they weren't sure what to do. They weren't sure how to engage with the private sector, and they weren't sure about the scale and scope of the private sector's resources that could be brought into the response. So it was really difficult to have resource-based planning because they didn't have critical data on private health sector resources and capacity. It just wasn't held by the government. So it's great to hear about the experiences of GFF countries who've actually done something about this to increase their knowledge of what the private sector can bring to the response. Also, we found that the private health sector itself was struggling because even though in some cases it was very looking really to contribute to the response, it lacked certain resources and capacity it needed to be an effective partner. And it took a long time for some countries to gear up and realise that this needed to happen. And partly this I think has been a problem because of a lack of public-private partnership dialogue platforms between the public and the private sector. Those countries who've had existing public-private dialogue platforms, including GFF countries, have done a lot better at working with the private sector in response. We also found that some of the legislation that countries have passed in relation to COVID actually made things worse. And in some instances, it's limited the ability of governments to involve the private sector. We've also found that there's some big problems with not understanding how to finance private sector involvement. Some countries don't have contracting mechanisms, for example, to deal with the private sector. And at the moment, we're doing some work to try and help with that. We're trying to produce some quick guidance on how to contract the private sector in the response. And the last thing that I want to the process running at the moment to try and address is that a lot of private sector businesses have been left out of the response or have been prevented from carrying out their day-to-day health businesses. And that's exposing them to significant financial losses. And this is important because if those health businesses go bust, then there's going to potentially be quite a big hole in relation to health service provision in many countries. And also we are missing out on a huge opportunity to involve private sector capacity in the response. So we're having a look now at what we can do to address this problem and to help governments with clear criteria on how to provide support for their private healthcare sectors so they don't go bust, particularly those private healthcare providers that are actually providing much needed services to the underserved and to the poor. Next slide, please. Thank you. So, learning from COVID, what can we do next? I mean, I think this is going to be the most important part of the webinar. What we've learned from COVID, as I said at the start, is that some of the things around private sector engagement that have been there for a long time have really been highlighted by the whole situation. And the WHO and with partners like GFF and the World Bank, we're trying to work out what to do next. So we are thinking about a number of different things which we have on this slide. So we think it's really important to support the private sector federations and public-private dialogue platforms. There are existing public-private federation and public-private dialogues in some countries, and they exist because they've been supported by various projects, but they're not widespread, and we think there needs to be more of them. We're also looking at what we can do to build better evidence about the contribution in the private sector through more work on publications and research into private sector provision. We're also looking at what we can do with training of WHO staff and Ministry of Health staff and other key actors on what the issues are in relation to the private sector, because we think there's a big knowledge gap. We're trying to create a community of practice of practitioners and researchers to better work on this topic. We're looking at setting up a coaching facility to coach countries who are struggling with the private sector engagement topic. We're looking to do more to set global standards so countries can be more assured about working with the private sector. We need to do a lot more work on data and how we can get better information about the private sector, but also how we can use data to improve the quality of government's ability to govern and work with the private sector, to share information and to ensure accountability and to build trust between the public and the private sector. It's a big agenda. And the last thing I wanted to highlight is the importance of global convening around this topic. Many different international agencies, the World Bank, GFF, WHO, USA, are doing work in this area. But what we think needs to happen is we need to come together as a group to better work together on how we can advance the topic of private sector engagement. Because it is a long-standing topic, and it's a topic which has been, where progress has been a bit slow, and we think we need to do something to accelerate progress, especially given the COVID situation, and especially given the need to build back better post-COVID. Thank you.
Thank you very much, Dave. That was very good for you to bring that part of the picture. I'm very happy to also go back briefly to Ethiopia to actually ask Dr. Tetet Kain, who's the General Secretary for the Myanmar Private Hospital Association and also the Managing Director for one of the hospitals, to talk a little bit more from their perspective how the collaboration given COVID has evolved before we move to hear from Ethiopia. Dr. Tetet Kain, over to you, please.
Yes. Binglava, I know that you all are in the various parts of the world. I hope and pray that you are all safe and taking care. Best wishes from the golden land of Myanmar. First, I'd like to thank GFF for inviting me as a speaker and the great opportunity to take part in today's discussion. Across the world, all healthcare systems are overburdened in its ability to respond to this unprecedented pandemic. In addition to the stress on the healthcare sector, this pandemic has also significantly compromised the economy and the livelihood of people in many countries. Fortunately for us in Myanmar, this surge has not hit as much as it has done in a number of other countries around the world, including our neighbors, China, India, and Thailand. However, this should not make us complacent and indeed, it gives us the opportunity to take stock and build a much more effective and efficient collaborative model, a model that is prepared to respond to a resurgence if it happens, and will help us deal with any other emergency or pandemic. Next slide, please. With regards to what I mentioned, I would like to share my experience. So let us start with working experience relationship prior to COVID-19. Without prejudice and disrespect to any agency or individual, I wish to place the first on the table. There has been limited engagement between public and private sector prior to COVID-19. The engagement was mostly punitive and focused on sanctioning private sector. And this created an environment of mistrust and the fragmentation. Notwithstanding, I'm pleased to share that once COVID hit, there is a greater willingness to coordinate and collaborate our efforts. Where we as a private sector recognize the responsibility and need to participate in the emergency response plan to flatten the curve. In fact, together we donated an unprecedented amount of goods and developed plans to repurpose for COVID-19. In addition, we created a conducive environment to engage with the public sector on how to work together to tackle the pandemic. Having said that, I'm aware that some private hospitals have already repurposed at a different level to manage COVID patients and are ready to go if the MOHS gives approval under the standardized guideline and protocol of MOHS and WHO. And I'm confident that these preparations could be coordinated and pulled together to work as one at a national level. Next slide, please. So now, let's look at the challenges. We did SWOT analysis together, and here are some of the key findings. The policy and regulation do not allow private hospitals to perform any testing, tracking, tracing, or treating COVID-19 patients. No coordinated mechanism to counter the refer patients between public and private facilities. In the main, private staff are not trained, nor are facilities repurposed to respond to the pandemic. No funding or pricing mechanism to compensate the private sector for the treatment of MOHS patients as a result of overflow due to a surge. The private sector was not engaged in the modeling of such management through density reduction, capacity release, and the capacity build. Again, I wish to reiterate that these conditions existed before COVID-19 and created the bottleneck that has contributed to the fragmented response that we currently face. As we have witnessed in the many other countries, Myanmar must be careful and be wary of the re-emergence of COVID-19 once our borders are open. Hence, it is reassurance that over the last month, the public and the private sector has worked together to develop a strategic framework to establish a PPP model to respond and manage COVID-19 and beyond. Next slide, please. So our main goal is to strengthen coordination and establish a collaborative framework for PPP health services. And the strategy is two-pronged. One, to certify private hospitals to test and treat COVID-19 patients. Two, to enable private hospitals to deliver emergency and essential health services for non-COVID patients. It is important for both sectors to be focused on these strategic areas to achieve our common goal. So one, establish regulatory framework and approval process to certify private hospitals. 2, assist private hospitals to become COVID ready. 3, establish mechanisms for private hospitals to deliver essential and emergency services. 4, establish mechanisms for public and private hospitals to coordinate capacity and capability for COVID-19 and post-COVID-19. 5, establish the funding and pricing mechanism to compensate the private sector for the treatment of MOHS patients. In conclusion, it is important we all recognize that we are not in post-COVID. We are actually still in COVID, and hence we need to be ready now. As the private sector, we are committed to help the nation to carry the burden by allowing the private sector to deal with those who can pay. The public sector release its capacity to treat those who are most in need, that is the poor and the near poor. To us, it is not about the economic value, but about the social value. So, and I have confidence that collectively together, we can fight this unseen enemy. Thank you.
Thank you very much. That was very powerful, Dr. Tetet Kain, and very clear in highlighting how you have taken together with the Ministry of Health very powerful steps to really address the challenges and collaborate, as you say, to deal with the current COVID-19 context. I'm very pleased to ask Dr. Marcos Feleke, who is the president for the Ethiopian Healthcare Federation, to briefly speak about the public-private dialogue to respond to COVID-19 in Ethiopia.
Thank you very much, Preta, and thank you for organizing this important webinar. Good morning, good afternoon, and good evening, participants, wherever you are in the world. I am the president of Ethiopian Healthcare Federation, which is an umbrella organization of the non-state actors of health in Ethiopia, private for-profit, private not-for-profits, and other NGO networks as well. We are largely private for-profit organizations represented under the Ethiopian Healthcare Federation. So, next slide, please. So, just to walk you through the pre-COVID, situation in terms of private sector engagement in Ethiopia. This started actually in late 2018. Supported by the World Bank and initiated by the ministry and some key private sector actors. So we started, to sort of formulate an engagement platform with the private sector and public sector in Ethiopia. But there were also some key events where GFF helped the Ethiopian private sector group, including the private sector engagement workshop in 2019, and when also the private sector assessment key findings were shared and validated with the private sector actors in 2019 in October, and followed about the same time. There were also this feasibility study for potentially 5 public-private partnership opportunities. In health, this is invoking the newly acted Public-Private Partnership Act of Ethiopia. And after that, we have been receiving ongoing support to strengthen our federation, and that has continued to some extent, to date. Next slide, please. So working together. So even pre-COVID, we had a structured, we had established, a structured sort of public-private engagement platform with the Ethiopian government counterparts, particularly with the Ministry of Health. But definitely, once COVID, came into the picture, then this public-private, sort of joint planning was, I would say, accelerated in a way. So we had, we have had at least 4 high-level engagements meeting, with ministry officials at the highest level, like a minister or a state minister of health involved, whereby, we talked about, how we can develop like a joint plan of action, how, the private sector's role can be leveraged or tapped, how we can coordinate, response in to COVID-19. So if I walk you through 3 major pillars of this engagement or collaboration on case management, in fact, cases were first identified at private health facilities, not at public facilities. So we had to coordinate even COVID and non-COVID response. On case management, again, while most of the public hospitals focused their response on COVID-19 related services, so the private sector was somehow, more focused on other essential services, which would definitely complement, what the government was supposed to do. And in fact, there was some elements of complacency, from the side of the government of not engaging in the private sector as early as possible. But now they have learned that, they should engage the private sector as well, even in the COVID-19 case management. So as such, we've been told, we have actually received a draft guideline to engage private health facilities throughout Ethiopia in COVID-19 case management, and that is being worked out. On testing, of course, there is only one lab, so as of today, doing testing among the private sector. But the private sector has contributed so much to the testing capacity of the country. If you recall, testing was about 2,000 to 2,500 a month ago, and that has doubled thanks to the willingness and flexibility of the private sector to collect samples and send those samples to the reference lab setups throughout the country. And of course, that's also in addition to the testing site expansion. But government was not able to maximally utilize the capacity it had, if it were not for the private sector's engagement. And we're also aware that a few more private health sector actors are expanding their capacity to also be able to do COVID-19 PCR testing, so we might have to see a few more testing sites. On logistics and supplies, there was a financial incentive mechanism created for largely local manufacturers, for them to receive support for production and distribution of PPEs. And in fact, even for those of us, who were able to bring PPEs and supplies from abroad, government, gave under it's the State of Emergency Act the flexibility to import, those PPEs and masks masks and other COVID-19 related supplies free of tax and duty, and also without also necessarily requiring the usual foreign currency permit, which would have taken 6 months to 1 year, to import something. So that is where being done. As we speak, we're trying to sort of better align expectations, better sort of straighten up. And we're also leveraging, on the opportunity of the 3 weeks sprint, the WHO and the World Bank group have offered to better coordinate our response with the government. As of now, we're still in COVID-19, but also in another some sort of political turmoil. Unfortunately, that's where we are on. But I must say that the COVID-19 situation has improved in many ways, the understanding and the potential of the private sector by public officials. So that's it from me. Next slide, please. Yeah, thank you so much, Greta. That's it for me.
Thank you very much, Dr. Feleke. That's very interesting. And I know so much progress has been made in Ethiopia since 2019 on the public-private partnership. So I hope that we'll continue making progress. As I realize currently it's a challenging time, but we're looking forward to hearing how things evolve in a positive way. I'm very happy to ask Sneha Kanagati to lead a panel session with many of you. And I also now see Caroline online. Hi, Caroline. Thank you for joining us. Good to see you. For those of you who don't know Caroline, she's the Principal Associate for International Development at Abt Associates. And she also works or leads on the USAID's Shops Plus program. And she's also an investors group representative for the GFF for the private sector. So thank you for joining us, Caroline. Sneha, I think only Dave may need a request to speak, so he can also join the panel. And then I think we have everybody here. So why don't you start?
Great. Thanks, Petra. So maybe just to start off with Dr. Choswale from Myanmar. You'd mentioned that the GFF and the World Bank have been supporting the Ministry on private sector engagement for quite some time, even before COVID. Could you share from the ministry side why you actually wanted to work more closely with the private sector? What was the motivation that was driving the ministries from that perspective? Choswale, are you
private sector is the... Hello?
Go ahead, we can hear you.
Can you hear?
Yes,
okay.
Go ahead.
So that the private minister also known that we must be change the private sector development. And in the side of our situation, we have the private sector law. There is the main things only. For example, that organization, there is a central body, is the authorized body. So that we have the plan to do the facilitate to engage the development of the private sector. We must to be advocate of each member containing in the central body. After that, we make this, the subgroups of the provide the development of the private sector. For example, that for my sector, I'm the facilitator of the private sector development. For the private sector, there is an investor and also the other side with the authorized body. Between the investor and authorized body, we must be close together and to make the dialogue. So So that in our situations, we have the think tank for the Ministry of Health. As for example, that the Myanmar Academy of the Medical Science is the ones of the organization of our higher professional and the ethical and other sector, many multi-sector, many sector professional groups. And it's a one group. This group is the think tank for the MOHs. So that such a kind of the local organization, and we make the co-group and the dialogue for the private sector regularly. But previously, we have the only quarterly meeting and at the central committee only, and we must push to the with the help of the World Bank and the GFF facility groups. We have the more dialogue between the public and the private sector. So we must have the more understanding and the more solution and more thematic areas and the more what to do that. For that situation, we have the priority area and the processing, the continuation after dialogue. So before the COVID, at the time of the COVID, this is the one factor to be good engagement between the fragmented sector to the organized network. So I think mine's only one thing. My working is the network or the dialogue. Regular dialogue is the can get the solutions for the future.
Thank you. And it sounds like you have quite a momentum going there. So it would be really interesting to see how this work develops. Dr. Thet, from the private sector side, in your presentation, you had mentioned that private hospitals can deliver for COVID treatment in many different ways. But since private hospitals also provide essential services beyond COVID, could you elaborate on a possible role for private sector in providing basic services, primary care, secondary care, for example?
Yes, of course. I also say that it is essential purely for the reason that in such pandemic, the collective capacity and capability must be mobilized and deployed. So there are numerous studies that clearly show that morbidity and mortality of the non-COVID is equal to or greater than the COVID numbers. So this preventable outcome could be flattened with the greater involvement of the private sector. So definitely, of course, we can.
Thank you.
And also, I'd like to say also the thanks to MAMS for happening the section, right? So we are the discussing together, and also we know each other. So happening for that, the MAMS is the main supporting to the private sector also. And also that Dr. Choswale, also I thank you, Dr. Choswale. He also always supporting to our private sector.
Thank you. And from the GFF side as well, we really appreciate the support and leadership from the ministry as well as from MAMS in this work. Caroline, because you've been working through the Shops Plus program with private providers for many years now, is there particular support that you're providing for the private sector to continue its operations during the pandemic?
Yes, so we're actually offering a whole range of support, much of it very complementary to what you heard from the speakers this morning or this afternoon or evening, wherever you are in the world. So we, as Shops Plus, we're a USAID funded program that works with the private healthcare sector. We continue to provide support to platforms very much like federations. We're also helping to create more regionalized local bodies. So like at the sub-national level, helping to create platforms so that these important discussions can take place, that you can do joint planning and prepare for the next phase of what's to come. We're doing a lot of training of private sector providers, even though what we're seeing is that private sector providers are not specifically involved in a COVID response necessarily. I think there's a lot of will and there's a lot of interest, but I think the operationalizing of how to actually engage those private providers is a bit unclear still for many governments and ministries of health. And so we're doing a lot of training of private providers to help them deal with acute case management of COVID, help strengthen lab capacity to test and diagnose so that they're ready and prepared once the government is ready to fully engage them in response. One of the other things we're doing, I think David was the one who mentioned, and actually it was mentioned in Dr. Tetet Kind's presentation as well, about a lot of these smaller facilities are facing a lot of financial hardship. With a decrease in client traffic to facilities, there are people who are worried about coming in. There's a lot of procedures that aren't being done in hospitals. You're seeing a lot of private providers and private health facilities facing some financial hardship. And so one of the things that we're doing also is helping to work with banks to restructure loans, particularly those loans that have been guaranteed by the U.S. government through its Development Credit Authority guarantee. And also working with those private providers to help them think through financial risk management plans, to think about how they might engage and think about restructuring things to help safeguard some of the resources that they have and to minimize the financial risks that they face. And then we're also supporting many private providers to procure the necessary protective medical equipment needed to treat patients, such as masks and shields and gear, gloves, etc. And always at the same time continuing to support private providers to be an additional resource on the ground. We have many clients who have private providers as their first source of care. And so there are a lot of, what we're seeing is a lot of different models of how private providers are innovating in the face of COVID and trying to restructure or rethink about their service delivery models to address some of the challenges of delivering care in COVID times.
Caroline, that's really helpful to understand all the different ways in which you're making sure that private providers can get the kind of support that they need as much as possible right now. And continuing with the private sector theme, Dr. Marcos, for the Ethiopian context, as you mentioned, you've been engaging with the ministry much before COVID, and this is only increasing now. What are the challenges that your members are facing, especially given the doubly difficult context of both the pandemic and some of the political sensitivities that are underway in Ethiopia? And do you hope that some of this can be resolved through the joint planning process that you described in your presentation?
Yeah, thank you very much, Sneha, again. Yes, we've been involved with the Ministry of Health. We have started, this joint engagement exercise a while ago, like more than 2 years ago. As you all know, the Ethiopian private sector is not small, even given by the Ethiopian government's standard. The reach in terms of service provision in urban areas is 40 to 50%. In rural areas, it is serving up to 20%. So this is according to government's own acknowledgement. So the private sector in Ethiopia is not it's not something that one can neglect. This has been very helpful, to straighten up and align expectations, with this kind of platform. But since COVID began, good things are like, we have been talking with the ministry a lot more frequently, and ministry is much more interested. But also, there was a lot of confusion and panic, particularly in the initial days that, we could not, make use of our resources in country, at least in a reasonable way. Like everybody was like, trying to focus on just COVID response, and essential health services were sort of neglected. I mean, just if you review the government's report, the past 2 months, a lot more people died of measles, a lot more children died of measles than actually, COVID. They are both important, but the point is, we're also seeing like a pattern of uterine rupture in urban areas like Addis Ababa, which were not there before. So the private sector's, resources were not necessarily tapped well. And there was a lot of confusion, who does what. So now, with new planning exercise, we could better, prepare ourselves as a country, not just as private, not just as public alone. So we prepare ourselves as a country. In terms of challenge, yes, of course, there are a lot of challenge. To David's point, he cited, the lack of, preparedness, from the side of private sector associations, in terms of being like a reliable. But there is like a chicken egg dilemma. Like you want us, to be able to partner with the government, to be strong, to the or you want us to be strong, and then, there is this confusion. That's one thing. This is a confusion that everyone is going through. In terms of resources, most of the resources that actually came to this country, they were just meant, to the public sectors. Unfortunately, we all know that the partners, including the World Bank, WHO, and European Investment Bank, European Central Bank, a lot of money has come to our country, but they were all diverted toward this the public sector alone. But yet, the private sector is still expected, much to deliver, even much more. It's such a paradox, that you would be expected to respond without having the resources. And of course, there were also like cross-cutting challenges, both to the government and to panic of the health professionals, lack of training, lack of preparation, lack of PPEs, lack of supplies. These were all challenges. So these are challenges that we could work together. And also the private sector has been struggling in getting, it's not that we don't have patients in the country. As I said, we have actually heard of reports of, uterine rupture in Addis Ababa, in the capital, like you've probably, WHO, they are aware of, the measles, epidemic, this past couple of months. But patients were not coming to health facilities. It means, private health facilities were going through enormous economic strain, because they cannot terminate contracts according to the new emergency law, and they cannot deny services, of course. And they were going through very, very difficult economic stress, and they are still going through. And paradoxically, you will see that government goes, and builds another standalone new hospital, which they could have used, from one of the private sector actors. They build and equip a new hospital, which is just set to be, demolished, right after the COVID-19 peak. So we were, but this engagement platform, the joint planning exercise, is helping us reconsider all this. Like now, the government has started to listen that, they could basically, sort of divert some of the essential services that were denied at public facilities to private health facilities. And, even COVID-19 treatment centers are now, overburdened. They are counting on the private sector as well. So yeah, this is what we are going through. I'll be happy, to get any follow-up question. Thank you, Sinaya.
Thank you, Dr. Marcos. That was many great points that you brought up, both in terms of the difficulties that are happening in providing COVID care, but then if we're not paying attention, the rise you're seeing in other preventable and treatable conditions, particularly for women and children. And so how do we create a safe environment for them to come in, whether it's to the private sector or the public sector? So thank you for noting that. Dr. Tetekain, on the Myanmar side, and we've heard some of the challenges for the Ethiopian providers. Is there particular support that the Myanmar Private Hospital Association and your members would need from the government, from the Ministry of Health and Sports during this time?
Yes, the learning from our exercise, our simple as is I highlighted in my presentation also. Most importantly is the establishing regulatory framework and approval process to certify private hospitals. That is our main highlighted. So the cornerstone of managing a pandemic, as we all know, that is the 4T principle. So of which test and treat, the part is the private sector can actively participate to release the capacity. Recognizing that the track and the trace component is we cannot do by the private sector, so mostly by the public health government center responsibility.
Thank you. Dr. Choswale, we've heard about the challenges that private sector is facing, but obviously with the COVID pandemic, there's huge strain that's placed on the Ministry of Health as well. Are there challenges that you are facing in engaging with private sector during this time? And is there a role for other support from development partners to help you manage this?
Yes, during the COVID period, and the example on me, studying the beginning of the Wuhan, and we just our ministers prepare to do the documentation process, and then the prepare for the emergency response team and the train. After that, myself go from the central area to the regional Yangon area, and the Yangon and the regional government and our Ministry of Health, the regional divisional deputy director general have the busy with the core body. So that, and the one thing is that we have the challenge to do that, and the resource is very important in Asia, for Asia, for the helping or for the suggestion or for the doable things in the pandemic field is the many area. For example, that the training area and the supply and logistics, and also the quarantine, and also the engaging. Especially our challenge is the engaging is a very important that. And in our area, another challenge is the communicable disease control law. Another control law is a little bit, the control law is established previously, so that according to the bylaw, we have the little bit undoable things, or a little bit difficult or conflict area. For example, that the general administrations and the Ministry of Health, there is maybe a rule conflict. So that one thing I have the challenges. Main thing is the engaging the organization. One thing. Another thing is that the well-wishers or the supplier, we didn't know the demand. We didn't know the blend. The well-wishers supply our hero like the doctor is our hero, so that they would like to be they support our hero, and they donate the such a kind of the PPE or mask or something like that. So in the figure that the people getting the things from the separate area with the high value or the expensive or very expensive money, but in my sector, the people well-wishers donated to me that there is a 16 kinds of the PPE. So there's a varieties of the PPE, low quality, and including me that we put on the PPE. There is no mark of the no size and no significant quality area, and so that the supply limited, and the limited or the supplying system is the one of the challenges to be covered, to be known knowledge or the sharing of the manageable our organization. So another thing is that the unacceptable measure, or for the example that any disaster or any make with the problem, many kinds of the problem, and in my situation, the people are including the people are the low resilience. I mean, that's the low resilient people, including the mental or the physical or mental one, and the other the matters something like that. The level of being is a very different level of being, so that we have the many problems to solve the such a kind of the level of different level of the being. And so we need the team, for example, that the drug addict people or the alcoholic people or something like that, that they are very arousable in the quarantine or curative area. We make for the group to be control mechanism, so that we have the team of the internet and the police persons and the other NGO to train how to be physically restricted and how to be managed the chemically restricted one, so that the organizational we must have the good at the internet organization and the well prepared the external organizations and the other supportive organization. Between the organizational networking is the important challenges of our situation.
Thank you, Dr. Choswale. That was a very comprehensive set of challenges and also the efforts that you're now putting in place to mitigate them. Before I continue with the panel, I'd just like to remind our audience to please send in any questions that you might have, for English to Petra Vergier's email and for French to Joy, so that we can have our panelists answer them in a few minutes. So, David, coming over to you from WHO, you mentioned in your presentation that there was quite a bit of analysis that WHO had been looking at for private sector during this time. Yeah. Were there some clear entry points that you see where private sector can come in to contribute so that ministries can consider these?
I think what's really interesting is to see how countries have responded as the pandemics developed in different countries. So most countries, as soon as the pandemic started, they were looking at the private sector for things like testing and tracing. But they've been really, really slow to turn to the private sector for things like treatment and to maintain essential health services, for example. But when they have, in some cases it's been too late because the health system's already been overwhelmed. And I think that's probably the key learning from all of this, that there has been a real lost opportunity, particularly in relation to the private sector providing essential health services and freeing up the public system to really concentrate on COVID. And that's a really critical lesson of all of this. And I guess it really goes back to why WHO is doing this work at all. And the reason we're doing private sector engagement work at all is we really recognise that in the 21st century, if half the health system is private, you can't just work with the public side of the system. Otherwise, you're only working with half the system and you're only getting half the benefit for the population. So really, we think that the whole COVID situation has really highlighted that we need to be doing far more and be far more creative around helping countries to work better with the private sector. And there's a lot of reasons why, we think there's a lot of reasons why countries are continuing to struggle with this topic. And we think there's a lot to be done, not just by WHO, but by other partners as well in cooperation to do something about the situation. And I think post-COVID, we absolutely have to get this right this time. A lot of people have tried to get the private sector in health topic right. And for various reasons, it's kind of stalled. And I think that the COVID situation really shows, particularly as we're likely to get more of these kind of situations, not less, why it's so important to get the whole health system working together for the health of the entire population.
Thanks, David. That also really echoes Dr. Marcos's point about how do you actually bring the whole country together to deal with this, and how do you make sure that you're using all the capacity on the ground, both the public centers and the private centers. Caroline, you mentioned earlier about how you're seeing some interesting examples of how private providers are delivering services and products during this time. Are there a couple that you could share that would be helpful for our audience to hear? And also maybe the other point that you had raised on how we are seeing more of this partnership between public and private sector happening around COVID. Are there particular reasons in your view that this is not spreading to essential services as well in the same kind of model?
Mm-hmm. Sure. So what we're seeing primarily is that the private health sector is adapting new strategies to decongest their facilities, right? So they want to reduce the frequency with which clients have to actually come in physically for services. And so we're seeing, for example, we're seeing the establishment of like triage sites within private facilities. So those patients that are suspected of having COVID are sent to a separate area so that they're not sort of mixing up someone who's there to bring, their child for some other service, doesn't get exposed potentially to the patient who thinks that they might be exhibiting COVID symptoms. We're seeing pharmacies do a lot more home delivery systems. So doing maybe multi-month prescriptions, doing dispensing that gets delivered as opposed to having the clients come to physically to pick up prescriptions. We know of a private facility in Dar es Salaam who's actually established telemedicine program for their family medicine and pediatric consultations that includes a mobile sample collection system where a technician will come to someone's home to collect the sample necessary to carry out the labs required for that particular visit. Telemedicine is actually something that we're seeing on the rise in a lot of countries where facilities are actually doing, just like in the US, where a lot of those sort of regular visits are being moved to more of a telemedicine platform. And so we are also working in some countries to help get visits that are delivered through a telemedicine system to be covered by insurance, because I think traditionally they haven't been. To your question about, why are we seeing engagement around COVID and why is it a little bit more difficult for essential medicine provision? I actually think that, one, it's the nature of the emergency response, right? So countries are faced with huge numbers of COVID patients in some cases and needing to deal with some of the overflow and helping, like David said, with the testing and the tracing. But I do still think that we're not seeing it to the extent that one would expect. Involvement of the private sector in the COVID response, and then you're seeing that the private sector is not involved in sort of maintaining access to essential services like preventive care and family planning and immunizations. And I think the primary challenges are the ones that have been elaborated by the panelists who have joined us today. One, there's not a lot of clarity around who the private sector is, their scope, services they offer, where they're located. And I think, having service level agreements or contracts in place for them to establish, to be an established provider of key essential services on behalf of the government requires, agreement on reimbursement rates. You have to have contracts in place. So there's a lot of preparation that's involved, that if you act early, if you think about engaging with the private sector early enough, can certainly be done. But I think when you're in sort of a state of sort of emergency response, or a state where you're dealing with a health system shock, I think it's very difficult to sort of do it quickly. And so if you have things like service level agreements in place, if you have, platforms where you're already bringing your private healthcare federations or your associations, your groups of networked providers together to talk through some of the issues. And I think, and if you can agree and you have conversations around what are those, reimbursement rates that are going to be fair to those private providers, the government is willing to provide in exchange for services, that I think you have the foundations of what would be necessary to have, to address any surge capacity needs or any maintaining of essential services that occur in the future. But I think because in so many countries, there's not a lot known about the private healthcare sector. It's very difficult. So I applaud, countries like Myanmar and Ethiopia and many others who have done private health sector assessments, and also those countries that have done censuses, like in the case of Senegal. Senegal has done a private sector census study where they know exactly all the private sector providers, the services they offer. They've gone back to do a more COVID-specific questionnaire to know what particular resources they have that might be useful in responding during this time. And so really just having more data and more information about who your private sector is, I think is really, really critical. But I just think it's very difficult. I think, again, I'm going to say in the to make something operational is difficult for many countries. I think they need the tools and the support and the technical assistance to really help them put things in place so that the next time there's a need to really quickly engage with the private sector, that those foundational structures are already in place.
Caroline, I think that's a really good point you're raising about whether putting some of these pieces in place now can build resilience in the health system and then sets us up better for the next time, which actually leads really well into the last topic for our panel before we open it up to the audience. I wanted to take advantage of having stakeholders across public sector, private sector, and development partners to ask all of you what we've heard today, and based on what you're seeing on the ground, how do we use this opportunity in terms of where public and private sector are coming together because of the necessity of COVID? How do we build on that for future health system reforms and service delivery reforms, and take the learning that's coming from this and the experience that's coming from this, and where would you like to see it go from your own perspective? So I would ask perhaps Dr. Choswale to start off from the Ministry of Health to say where you would like to see this work go over the next 5 years or so, even beyond COVID, between public and private sector.
It's the rare chance of I think in the government service period, and including in my life. And also our senior members also noticed that this is a chance to do that without the private and the public combination or dialogue or collaborations. We can face every time such a kind of the huge pandemic or any other disaster we face with many failed area or failed period. So. And for the next future plan, we have to do that. They make the collaborations or some empower or some establish any worrying. I know I may not mentioned exactly. And for the MOHs in my situations, our movement would try together to the one common road to the fragmented position. For example, that in the National Implementation Unit and the National Health Plan Implementation Unit is a very important chapter of our roadmap, and also the Sustainable Development Plan and of our government, the action plan to move together the private and public collaboration together, so that our future one is our interministerial or the intra-ministerial, including the other organizations that we make to do with the under the law and under the law with the subgroups or steering groups or any technical working groups together, and then move toward our solutions, the priority and our doable things and the future plans. And MOHs and also our groups have the strong desire to push our government and also our MOHs put together private and public sector doable thing together, and if there's no document regulation, we submit the regulations for the future. We expected that it can be more feasible and doable the private sector and the future in Myanmar. Thank you.
Thank you, Dr. Choswale. Dr. Tet, would you like to add from the private sector side how you would like to see this engagement post-COVID over the next few years? I think you're on mute, Dr. Tet. We can't hear you. We still can't hear you.
Sneha, I suggest that Dr. Tet refreshes her screen, and meanwhile, maybe you can
sure, I could
ask
call on the other
questions to another panelist.
But we're not sure if Dr. Tet can hear us. Maybe if you want to send her an email as well. But Dr. Tet, if you can hear us, I think you might be.
Okay.
Yeah, go ahead.
I think she's online now.
Yeah. Sure. Definitely we must continue the partnership with the MOHs, even indeed not only the COVID and also for the future also, because now we are also achieved to the UAC goal, and by the 2030. So we all need to be work together to achieve our goal. So definitely that is we need to do for that. So and also for the future long run, also the area mainly we need to be partnership with the MOHs. That is the one as the engaging the private sector mainly is to build the human the capacity and capability, and particularly related to the education and training. So now at the moment is the brain drain to other countries. So that is very important for us to prevent the brain drain. That is the main also partnership with the MOHs. And also for the develop the partnership service delivery also. The public sector infrastructure is available for those who need in the most relation to their affordability level. So we all as the partner with the MOHs in the future, we hope, I think we will work together in the future.
Thank you, Dr. Tet. Dr. Marcos, would you like to share your vision from the Ethiopian side as well for the coming years?
Yeah, thank you. Of course, the current COVID pandemic, has brought a unique opportunity of, to understanding, each other's potential and how we can complement with each other, like the public and private sector. So as such, I would say, we have to prepare, number one, to maintain, to continue this engagement, to strengthen current essential health services from COVID-19, during the COVID-19 and beyond. And of course, even, this engagement is very important for the next pandemic. So it's not whether we have it or not, it's when we will have it. So I think, we have to straighten up and, prepare ourselves, and we have to build on the current experience and sort of, document all what we have gone through and, see our resources, see our weakness, and see how we can complement with each other. I think that's from my side.
Dr. Marcos. Caroline and Dave, could I ask you to hold your thoughts on the future of public-private engagement until we maybe get some questions from the audience so we can circle back at the end? Thank you. Petra, over to you.
Thank you, Sneha and colleagues. Very interesting discussion, and we also have received many interesting questions. So I will start with some country-specific questions and then come to some more overarching questions. From Cameroon, there are some questions for Myanmar, particularly on the financing of the private sector and what mechanism has been used. Firstly, the question, has the private sector received financing in the context of COVID-19? And if so, through which mechanism? That's a very particular question. And in regards to that, and I think some of this you already elaborated on, but there's often a lot of information in these sessions, so I'll ask you maybe just to reconfirm, because they're very keen to understand to what extent private laboratories have been engaged and private health facilities have been involved in caring for the COVID-19 cases, and whether private sector providers are provided with PPE. So I don't know, Dr. Tet or Dr. Choswale, who would like to start?
Yes, I would like to answer the search of financing mechanisms, and according to our experience up to now, and in the public health emergency, our country do, and up to now, and free for everybody, no exact one. Because of that, in the public sector, private health activities, we have the sector of the quarantine sector, and the testing sector, and the treatment sector, and also the follow-up, so that the government or our organizations make all free now. But for example, that for the testing for the PCR, before the PCR tests, we have the one test maybe run about the 120 or per run the particle test tube. But previously we have the sometimes we mix for the per half cost. Per half cost is the about the 2 lakh, maybe I think that maybe nearly $200 per test for the PCR. But sometimes 100 samples are not the regular result, so we have the second run. So that this is a very expensive cost for the private one. So that our government made to be resistant to make the proper the diagnosis with our capacity and our financing mechanism. But the future, it is a very heavy workload for our government and our health sector, and so that the free of charge for everyone to up to now, but for the future. We have the many issue for the future. One is that, for the example, the foreign going people, we have they get the COVID-free certificate, and after that we make the charges now. So another thing is that we have to prepare for the UAC, and we make the draft of the UAC law. In that law, we have the strategies purchase. We must do such a purchasing organization to be developed for the risk pooling, so that our country have the plan to go to the UAC, and the UAC, and our core team make the draft of the UAC law, and in that law we have the pooling mechanisms to be change our health system step one, including the UAC goal. Our private needs to engage in preparation for the service readiness, so that in my main points, our service readiness is a very, very important to our financing mechanism. Thank you.
Thank you very much. Dr. Ted, would you like to add, particularly on the questions related to what the private health sector is doing?
Now at the moment, it's the private sector, not much involved in our COVID. Dr. Choswale also said that, right? So the public, the sector, the MOHS, also the responsibility to do for that, all the testing and also the quarantine and everything, and all are the free of charge. Also, Dr. Choswale said that. So that's why we are sit down together and for the future, right? So the private sector, how can we involve in that also to reduce the public capacity release also. So that's why we are working together, and the future long run also the private sector can respond to those who can pay. So at the moment is that also the Dr. Choswale also said that, right? So we are sure also we are discussing also to achieve the UAC, and also we have to work together in the future. Yeah.
Thank you. Very important points. And I'm coming to Dr. Veleki from Ethiopia. Something similar question for you from Burkina Faso. It's very interesting to hear about your public-private partnership and platform. Could you indicate what process was taken to develop the platform? And how did you manage to mobilize the private sector? And what mistakes should be avoided? What can we learn from the Ethiopia experience? Can you please share?
Yeah, thank you very much, Petra. The process that we have followed, it was a very long process, would require a lot of patience, compromise, and understanding of each other to come together. So first of all, the most important thing, that precedes everything is to organize as one private sector entity, as under one umbrella organization. But before you can go to the government and then, talk in a fragmented way, the most important would be that, all the key You can't. Everybody cannot be, organized under one federation, but most of them could definitely be organized. So you must first, organize yourself as an umbrella organization. That's one thing we did. And as such, to do this, we have reached out, key associations, private hospital associations, importers association, clinic association, lab associations. In fact, we at Ethiopian Healthcare Federation, we are like a super association. We are association of associations. So we're an umbrella organization. That's the first thing we followed. And the second thing we did, just grossly, is to sort of, hear from our members, what are the things that matter to them as one. Of course, some of the issues that matter to clinics may not necessarily matter to hospitals or those in supply chain or those in manufacturing. So what are those, key cross-cutting, points that we can work together as one private sector? So these are very important. So this will, took us to sort of the agenda setting, from our side. And then we had also to reach out to government sector, government counterparts, to hear from them also and to learn more about their expectation. And also in the past, what we can do as a private sector, and also share, the experience from other countries where, the private sector has successfully worked with the public sector. So they would see and appreciate the potential of the private sector coming together with the public sector. So this was very important in aligning, our expectations and trying to see the potential of public-private dialogue or public-private coordination. So these are grossly, what we have followed. And also there are challenges, making this regular, making this acceptable to all, making this, work and really on the ground. These are actually some of the challenges, we need, like a strong secretariat office, a strong leadership and the board, also strong commitment from the leadership of the board, to avail themselves. This is more like, even though it's a private agenda, it's more like public service. So, we need, committed, leadership and committed, board and secretariat office to undertake this. Yeah, over to you, Petra.
Thank you, Dr. Filecki. Very important. And I really appreciate how you elaborate. It's really a collaboration, and it requires from both ends work on the private sector to get better organized, and then also engaging on the public sector side. Maybe if I can just ask Dr. Filecki to please mute your mic. Thank you. Then I have a question for Sneha. It has become clear that managing the COVID response is not just a health sector issue. The economic interests of the broad private sector and each country and the public health interests are inextricably linked. Much of the discussion has focused on private health sector providers' participation in COVID management, but what about a broader dialogue with the private sector on issues of prevention, both in terms of how they manage their operation, which I think we've heard something about today, but also how can they directly support public service messaging in which some of them may be quite skilled, or the potential role of the admittedly constrained financial sector to more flexible resources be made available for those in the private sector working to expand services. And related to this has been a question also from Cameroon, like would there be an answer of should donors finance private sector to help support this challenging aspect? So the easy questions for you, Sneha.
Thanks, Petra. So I'll take the first question about broader private sector. I think that's a really good point. We have so far been focused around health services and how do we put those in place given the immediate challenges. But indeed, things like workplace safety are a key aspect that private sector can get involved in. And I think this is where a leadership role from the Ministry of Health would be important in a given country, because there would be specific guidelines that would be put out there, as well as some of the norm-setting partners like WHO and others who are putting this guidance out there for private sector companies to follow to keep their employees as safe as possible. And we are, of course, already seeing in many countries this shift towards online work and remote working instead of putting people together in one location. And I think one of the questions to grapple with is probably how this is going to continue for the near future, and whether some of our GFF-supported countries need additional resources to actually adapt to that way of working. May not be one that's prevalent now. And I think also the point that was raised around whether the private sector can contribute to some of the behavior change that is required. I think telecom companies in particular have a very important role to play there. I mean, even in India, where I am now, I often get messages from the government on my cell phone telling me about the symptoms to look out for and where I should go and which numbers I should call for the helpline. And I think more countries are turning to that as a mechanism, because you can really reach quite a large section of your population, especially for countries like Myanmar, where there's a huge cell phone penetration, but also in others, looking at other media channels as well. And maybe just to have you repeat the question from Cameroon, Petra, in case I didn't cover it. Was it the role of donors in delivering these services through private sector?
Particularly whether the solution would be to have donors support the private sector. I think the question is about, and this is another question that came from somebody else, also in Burkina, asking, should the government finance the private sector during COVID, or should donors finance, or who should finance this? I guess that's the main question that countries are struggling with. I think everybody sees the benefit.
Yeah, but how? And I think this might be one that's a little bit context specific. I know in several countries where we already have GFF and World Bank funds that have contracts set up with private sector, being able to continue those during this time with COVID ensures that that's one place where people can continue to get their services. But in terms of putting in place new contracts, it may in fact be, this is I think maybe one that I would love to get other opinions from our panelists on. It might be quicker in some ways to have donor funding set up some of these short-term contracts versus using government budget allocation, which may require a longer approval process and reallocation process. But I think this is something that would have to be discussed specific to a particular context and wouldn't necessarily be a sort of blanket application. Maybe I'd briefly ask Caroline from the USAID and SHOP side whether this is something that you want to weigh in on as well.
Go ahead, Caroline.
Sorry. So let me just start by saying that donors like USAID are already supporting the private healthcare sector. They are already purchasing PPE for private providers, or investing in training for private providers, or helping to equip private providers with commodities needed and lending. With regards to contracts, whether a donor could cover the cost of reimbursements for the expansion of services to the private sector, I think anything is feasible. I think it'd likely be a very short-term solution because ultimately what you want to see is have those arrangements be led by ministries of health and government, and be part of their national budgeting exercises, and having the funds there to be, to continue to fund those service level agreements and contracts would be, I think, the long-term goal.
Thank you. I think I can see, Dave, I was going to come to you that if you wanted to weigh in on this. So we're telepathic. Go ahead.
Thank you. Because I agree that this is a really important topic. And what we're finding is that a lot of governments don't know what to do. So what we're doing at the moment is we're producing some advice for governments on how they might support the private sector. So looking at the sorts of tools that they could use to support the private sector, whether it's supporting them to use contracts or vouchers or other tools. But we're also looking specifically at the whole question of bailouts, and whether or not governments and donors should be bailing out the private sector, and what criteria they should be using to do so. because we have seen bailouts. We've seen examples in some of the OECD countries, and I won't name which countries, where the big hospital chains have been bailed out by the government. And what's tended to happen is that the money has tended to go to not necessarily to those providers which are serving the most underserved, and we think that needs to change. So right at the moment, we're running a survey across all the WHO regions to get more information about this, with a view to writing something to help inform government and donor decision-making about this.
Thank you, Dave. And that also links to a question that I saw was about, are there tools or documents that can help guide private sector engagement in question in the countries? And I saw that you posted the link to the website. So we will also make sure we circulate this link to everybody, post the email, so that everybody can access it. Do you want to add something to that, Dave?
I would like to add. So what we found when we started doing the COVID work was that there is a lot of existing material about private sector engagement. I said in my presentation, this is not a new topic. So what we've been trying to do is repurpose some of this material to deal with the COVID situation. And we've put this material on the website I highlighted. And we've also created a resource clearinghouse where we've tried to capture as much information about countries' direct experiences as we can. So you can go to that resource clearinghouse and have a look at what countries are doing. You can search by country, you can search by topic like testing, etc. So we recognise it's really, really important to provide as much information to people as possible to make better decisions. What we've also been doing is trying to better understand what countries' actual problems are. And so I think sometimes we make assumptions about what the struggles that countries are facing. So we've been doing surveys of countries to try and better understand what the policy issues are. And we've been developing new tools and information to support countries through this COVID crisis. But we're also, and I'll just get to this later, we want to link back to the long-term solutions and what we do with the private sector longer term, because I think there's a big agenda to do something different in relation to private sector engagement post-COVID. And, in this much vaunted and discussed Build Back Better scenario.
Thank you, Dave. I think it's a very important point, and I think many countries are seeing the impetus of this. So related to this, I'm coming, Sneha, to you. A couple of questions about, firstly, Burkina Faso is interested in creating a platform or a partnership. What support does the GFF provide in this context? And what mechanism can they establish to install a real participation from the private sector? And I think we've seen this in many of the GFF countries because there's fragmentation and aspects it's not always been easy to. So what are some of the lessons, I think, to think about there? And what are the main features of the support provided by the GFF? So can you maybe shed a light on that, Sneha?
Sure. Thanks, Petra. So for the setting up the platform or partnership, as we've done in Ethiopia, it really involves leadership from the private sector side, and then the GFF and partners come in with some funding and some technical assistance, a bit of a facilitating and a brokering role to actually bring different parties together, because we've seen that it can sometimes be helpful to have a third party bring different private actors together under an umbrella, as long as there is strong leadership from the private sector side itself, because this is something that has to be sustainable. And even though this is setting up a platform that brings private sector together, if we assume that they also want them to then interact with the government, you need a strong counterpart on the Ministry of Health side to actually be able to have that leadership role as well, because it is important, I think, for private sector to see that the ministry is supportive of these efforts. Otherwise, it may not actually lead to something down the line. In terms of participation, I think this has been an issue that's come up in a lot of GFF country platforms about how can we really make this a productive engagement from the private sector side for them to participate. Partly because some of the platform discussions can be very broad, and private sector, we all know, is very busy. And so we have to make it worth their while to actually be engaged, and also have a clear remit about where and why they're engaged in the platform. So in Côte d'Ivoire, we tried a new approach where we had a private sector working group that was set up as part of the country platform, which looked at issues that were specific to the private sector, including their enabling environment, looking at where they could contribute to the work of the broader platform around financing for performance-based financing, using that modality to expand health services. And then the private sector group was supposed to feed into the broader discussion. Of course, that can sometimes become a bottleneck because if they're not adequately linked to the broader platform, then the working group ends up being less effective. But it has worked better than in the past where we just had a private sector representative in the broader group, because I think then it becomes one voice against many. But it is important to note that if you are developing a technical working group for private sector in your platform, you should make sure it's not only private sector that's in that group. You, of course, need Ministry of Health representation and you need development partners and CSO, because it needs to be a microcosm of the platform itself with a focus on entry points for the private sector, because otherwise I think it again becomes a private sector trying to talk to the rest of the group instead of this more joint effort. And in terms of the support that GFF can provide, I think we've actually just started doing this in Niger as well. Typically, we do a bit of an assessment on whether there are existing platforms, what is the state of dialogue between the public sector and private sector, including between the private sector. And then we can make some recommendations on a particular path or way forward for developing this kind of mechanism. We provide technical assistance because we have consultants that are trained in doing this who helped in Ethiopia, but also in several other countries, including in Myanmar. And there is some funding that can be available through the GFF partnership if this is prioritized amongst the dialogue that's ongoing there. So I'll stop there, but happy to also have a call separately with the Burkina team or anyone else as helpful with our focal points.
Thank you, Sneha. I think that will be very helpful, and I am pretty sure that Dr. Syed Aziz Arab from Pakistan would also want to have a discussion. He's highlighting how, you know, they have very innovative approaches from Green Star Social Marketing, which has across 7,000 service providers and 120,000 retail outlets and 35,000 pharmacies across Pakistan. But they are definitely also facing many of the challenges we've been talking about today in regards to access to PPE and the importance of essential services. And this comes to the same point that was made very early on by Dr. Verleki as well. It's really important to think about how to maintain the essential services. And for him, he was highlighting the importance of including certain services as essential services so they can also be provided by the private sector, such as reproductive health and family planning and TB and HIV, as well as looking at several, making sure that the commodities and so on are taking a holistic view, which I think you've highlighted from several countries that these discussions have been going on. So I think this is definitely something to continue discussing. From Senegal, similarly, a colleague, the country director for Marie Stoop, is highlighting that we shouldn't wait for a pandemic or an epidemic to engage with the private sector. We really need to ensure that this partnership exists and is maintained so that it's integrated into the national strategy. And I think Dave will probably want to come into that on his closing remarks. So because we're coming to sort of the end, I'm just going to two last questions, and then I'm going to ask each panelist to give their final thoughts. And I'll go to Myanmar first, and then I'll come to Ethiopia, and then I'll come to Dave and Caroline, and then I'll end with Sneha. So the two last questions that I have, one is about, for Ethiopia particularly, is there also collaboration with the employers' organizations that have more means and maybe have private health sector providers, like employers that are having their own private health sector providers? And then the question for both Bangladesh, for both Ethiopia and Myanmar, but also applying to other countries. And we know it's very critical, is a question from Bangladesh, how the private sector is reporting into the health information system, and how are they being made accountable and ensured that the reporting happens, and what is the monitoring system that is in place. I understand from Senegal that in Senegal with Marie Stopes, they have some experience on the social franchising and really taking responsibility for quality of care to carry out regular assessments and ensuring compliance with existing norms and standards. But what happens in the current situation in different countries when it comes to the reporting into the health system and the accountability aspects? So let me start with Dr. Choswale. If you don't mind reflecting on these questions and any final thoughts you may have.
Yeah, for the reporting system in our private hospital, we have the DHIS2 platform. And the current situation, I have the already training to the 1, 2, 4 hospitals of the private hospital. I have the total, so 2, 4, 5 and the private hospital now. So half of the hospitals have the DHIS2 training. But the reporting system, I review on the DHIS2, we have the the more significance or more validated reporting system must be input to our situation. So that in my real situation, we have just introduced to our private and our private hospitals with the DHIS2 platform by the MOHs under the MOHs control. But another we now the reporting system, the providing another data platform to strengthening the registration process, and also the reporting or other emergency the announcements or other documentation. We have just started the journey for the information. So and in my MOH, so we have the now the establish of the websites and server and the IT team, but the health information system also already established for the public hospitals, not all the private hospitals. We have just started to input the DHIS2 information to the health information system. Now, the further future, we make the data platform the year by year with the national health plan. Thank you.
Thank you very much. Dr. Ted, would you like to add something and any final thoughts for sharing with the participants? We have about more than 200 people online, so there's a lot of people interested to hear.
Yes, also the Dr. Choswale said that at the moment also the MOHs also they just started, and also among our private hospital also most of the hospital we don't have the system HIS system yet, right? So to use the same platform and also to for the reporting, so we have to work together in the future. So last the 3-week discussion also we raised that that reporting system also. So when we get together, use the same platform, so we will get the nationwide data in the future. So that's why we are discuss for that also. So we are just started. Also the government, also the Ministry of the Health also just started, and also our private hospital also. Some are now they would like to start the use HIS system.
Thank you, Dr. Ted. That's very interesting. I will ask Dr. Frelicki if you're able to respond, and if you also can say anything about the question I raised about private sector providers and the employers' organizations, please.
Yeah, thank you very much, Petra. On the engagement of employers in the COVID-19 response and beyond, fortunately, some of our federation members are employer associations themselves. So they are organized or they are recognized as by the government as employer associations as such, like the Addis Ababa Private Health Facility Employers Association, for example, as one key member of our federation. They're not just working as health facilities or not just as health professionals themselves. They are actually working as one economic, key player. And as such, we said, earlier, the COVID-19 response is not just, health response. It is, and as a whole government's response, the whole system response. So they were taking part in different, other ministerial level task forces, other than the health sector one. So their engagement was quite strong, and they were very helpful in aligning, expectations from employer side and from health professionals side. On reporting, I must acknowledge that it's a very difficult thing even before COVID-19. But obviously, the COVID-19, specific, data, and data collection and reporting is much better. There are some mandated, reporting requirements like, ICU admissions, zero pneumonia, or any suspected case of COVID-19. There is an established, there is an established system whereby both private and public facilities are required to report through. That is not like a well-structured or systematized one. It's largely a phone call, like you just have to place a call to district health officials or city health officials, maximum regional health officials. But the rollout of DHIS2 with private health facilities, in private health facilities, is very, very slow, if not non-existent. But we are aware that, the public health facilities are using DHIS2, and they are also filling up additional reporting requirement from the side of the government. The Ethiopian Healthcare Federation is has offered to the government to help with this, among other issues. Reporting is one. Reporting and coordination is one thing that we can contribute to the to the public system, to the government as such. We've heard back from them, that they are interested in this. It just that this hasn't materialized. On a final note, I would say, the complacency of private health facilities or public health facilities, that they are enough to respond to this pandemic or to any other challenge that we'll have in the future, including, maintaining and sustaining, provision of essential health services, must end. We should work together. We should appreciate each other's role. We should work in a more coordinated fashion. And it is not an option that the public and private health facilities should partner. It is a prerequisite, to respond in an organized manner. So I call upon, my colleagues from other countries in private and public sector to see, ways of, coordinating, how they can respond. And we're also too far, from fully utilizing our potential. And we appreciate, the leadership of the ministries and, financing institutions or funding agencies like the bank, and also, cluster leads, in each other's countries like WHO, to show their leadership in coordinating the materialization of this. Thank you very much.
Thank you, Dr. Faleki. That is very helpful. I'm coming to Dave. I know you had some thoughts also on the longer term vision. Your final thoughts. You're still on mute.
Sorry, yeah. I couldn't find my mouse. I think there's a couple of things I want to say. First of all, I really commend Ethiopia and Myanmar for the great work they've been doing in relation to bringing the public and private sector together for the response. And I hope that this will continue post-COVID and that we can learn the lessons of both countries' experience and share those lessons with others, because I think what's happened in both countries is great. The second thing I wanted to say is that WHO for the last 2 years has been working on a new strategy for private sector engagement. We have an expert advisory group who've been helping us with this work, and we're going to be releasing it soon. We put it on hold a little bit because of COVID, but I think what COVID has shown to us is the need for a new approach and for this strategy. And post the release of the strategy, we're also planning to convene different partners around this topic, because we think for too long, efforts towards private sector engagement have been a bit fragmented. Different agencies have done amazing work, and GFF and USAID and some of the WHO programs have done an amazing job with private sector engagement. But we think there's now a time to actually build on this and look more systematically at how we can work in the whole health system. Because I think a lot of the work that's been done in the private sector engagement over the years has really been focused on specific programs like TB or maternal health. And now the time has come to look at the whole health system. And I think that's where we all need to come together as a global health community and bring together also the public and private sector at country level to see how we can do a better job on this. Because if we don't, we're not serving the people that we all serve. We're all serving patients in countries. We all care about the outcomes for patients. Unless we work better together in the public and private sector, then we are not serving our constituency, our patient constituency well at all. Thank you.
Thank you, Dave. And Caroline, I'm coming to you, but before I do, I have one comment for you and one question for both you and Sneha as GFF representative. So the first one is a comment to you, Caroline, to support some better collaboration at country level with Shops Plus in Senegal, particularly. So that's a request I'm asking you. And the other is related to, is coming from Zambia. Listening to the presenter from Ethiopia, he correctly underscored the need to recognize that the private sector is not a homogeneous group of entities, and that the best way to reach them is through the private sector associations or representatives. So the question is, has the GFF considered capacitating these organizations in developing countries so that they could become a natural platform for more structured engagement with all phases and sizes of the private sector? And I know this has been something we've been discussing for quite some time. So maybe Caroline and Sneha, if you can both reflect on that in your final remarks. Thank you.
Sure. So why don't I start, Sneha, and then you can wrap up. So one, sure, certainly Senegal, we're happy to do more close collaboration on the ground. We're doing quite a bit of work with private sector engagement and the Alliance du Secteur Privé in countries. So I think there's a lot of opportunities for closer collaboration, particularly with the GFF team on the ground. I think that I absolutely agree that the private sector is not homogenous. I think one of my key sort of takeaways or sort of closing comments was going to be to recognize that the private health sector is made up of service delivery providers, but it's also made up of private health industry. And there's also lots of ways that we work with other sectors in infrastructure, telecom, things like that that support the health service delivery. So thinking about private sector quite broadly is also really important. The need to get organized. And I see, you know, the federations and the associations, which are really good platforms and vehicles to bring a unified voice for the private sector. They do need strong secretariats, and that does require support. It requires funding. It requires technical assistance. It requires learnings from other country examples. And I think, you know, we as you know, interested champions in the private sector need to figure out how do we sort of help strengthen those nascent groups that are growing in some of these new countries that are embarking on establishing platforms. I hear a lot of interest from Burkina Faso. And then finally, I think just to also recognize that once you organize, it makes joint planning really easy, right? Once you know who your private sector are and you have a sort of, you know, more sort of a platform through which you can get a collective response from the private sector, then I think it makes joint planning easy. It makes helping to establish plans for the next epidemic or for the next issue, for the next health system shock a lot easier. So I think having an organized private sector and having a platform through which joint planning becomes you know, more easily facilitated is critical. And to keep in mind that there's lots of resources, right? So you heard David talk a lot about the WHO resources and the website. We know GFF through Sneha's work also has a number of resources, and then USAID, because they've been working in private sector engagement for so long, there are a lot of resources available as well. So I think there are some learnings that can come from where we are currently and helping to sort of pivot and think about new ways to do work. But there are some best practices and some lessons from just past engagement that I think could be very useful to everyone on this call.
Thank you, Caroline. And you speak to my heart when it comes to knowledge and learning and really learning about the past experiences. So we will definitely also look into that more and more. Sneha, over to you.
Thanks, Petra. I'll start off with responding to Zambia before going into my final remarks. I think the Ethiopia example is actually a good one of where GFF became engaged in supporting the Federation to come together, providing the TA now as you're strengthening and ramping up. And this is because I think when we worked with some of the early countries, we realized that the countries where there were these private sector federations, we got a lot more traction because there was a clear leadership and counterpart from the private sector compared to countries where there wasn't this kind of umbrella association. And this is why when the Ethiopian Federation was coming together and they requested World Bank and GFF support, we agreed that this was a very important thing to do. And I'm wondering also whether there's a value here that we can offer in terms of facilitating cross-country learning, because I know Ethiopia benefited from help from Kenya and Uganda, from people that were in the federations in those countries and brought their lessons to Ethiopia for its own work, and that could benefit future countries as well. So I would suggest that if any of the countries that are on the line right now would like to discuss this further, please reach out to your GFF focal points and we can make sure that we set up a discussion to look at the specifics of what you have in mind. And I'd also like to emphasize the partnership approach of GFF. You know, we've heard about the resources that other partners have available, both including the ones on our panel, but others as well. And we'd like to highlight that for GFF, it doesn't have to be the secretariat that is always the one providing the TA or leading the private sector engagement in a given country. Pakistan is actually a good example where I believe USAID has taken the lead in supporting private sector work through the country platform. And we think that in the next phase, as we're seeing more demand from countries and more partners who are willing and able to support this, we'd like to actually support each other in a way that we get the best use of all the available partner resources. So it doesn't have to only be the secretariat that countries should reach out to. If they have an existing program with a good relationship with the ministry, with any of the partners that can provide this support, we're happy to facilitate and make sure that happens as well. And just in terms of my final remarks, I think we've heard a lot of great points from our panelists, and really thank you so much for joining us for this discussion from all across the world. The only point that I think we didn't explore perhaps in more detail was the role of innovation and how I think the pandemic has forced us all to find new ways of working and find new ways of delivering the things that need to get to the people that need them the most. And this perhaps gives us an entry point in the near term to figure out where in the health system we can more effectively use technologies, products, new service delivery models in a way that we may not have otherwise, or in a way that might have taken much longer without COVID bringing us to this point. And so I know this is an area that GFF is working on more in this innovation space, and I'm sure we'll have more information to share with our countries soon, but wanted to put that out there as a placeholder. But otherwise, just to close with saying thank you very much, and really great discussion from the audience and from our panelists. Thank you.
Thank you, Sneha, and I agree. And I think there's so many innovations and other aspects, including better private and public-private collaboration, given this COVID context coming out of this, that we really want to maintain beyond. I think we focused on the private sector collaboration, but also very much highlighted the integration that countries can not only focus on the public system, they need to look at the public and the private, so they look at the whole health system. We don't want countries to only focus on COVID response. We also want to ensure they maintain essential health services, because we know more people may die because of that than COVID in some of the countries that we're referring to. So it's really important to look at this holistic approach that is integrated in everything. And I just wanted to say one thing, and that maybe comes to also give a little takeaway for the next webinar that we are likely to hold, and that is about looking at data. And this was a question that came from Bangladesh. It's really important to use data to inform decision making in this context, because it's even more complicated. So many partners and the GFF as well are supporting countries to better look at their data, both the traditional health information system, but also using more innovative mechanisms like phone surveys, whereby not only the public sector should be taken into account, but also the private sector, to really see what's happening in country to help inform the decision making. And as this work is moving ahead in many countries, we will probably next time meet up and share some of the findings of this and some of the learnings that we have to share to ensure we really use that data to also help us decide what are the best actions. So with that, thank you. There have been more than 200 people online, so I can see how much interest there is in this topic. Everybody, please stay healthy, stay safe, take good care of yourselves, and look forward to seeing you here again next month or in the near future. Take care, everyone. Bye-bye. And thanks to our presenters for a fantastic panel and session. Thank you.
Yeah, thank you. Thank you all.
Thanks, Steve.